You are the nurse in the psychiatrist's office taking care of a patient who presents with 3 years of pulling at her hair in a compulsive manner. The patient states that she has a strong urge to pull her hair out, especially in times of stress, and that removing hairs helps to relieve tension. She is bald on 2/3 of her scalp, and feels very distressed and socially impaired. Which of the following best describes this patient's illness? A. Agoraphobia. B. Walking corpse syndrome. C. Social phobia. D. Trichotillomania. E. Arachnophobia. The answer is D. Trichotillomania. Trichotillomania describes the obsessive-compulsive condition in which patients have an uncontrollable urge to remove their hair, which causes baldness, and social, emotional distress and impairment. Patients typically pull hair from the scalp, eyebrows, lashes, and extremities. Treatment includes a variable combination of psychotherapy and/or medications. On the other hand, the other choices are incorrect. Walking corpse syndrome is a psychiatric condition in which a patient thinks that they are dead, while in reality, they are indeed alive. Arachnophobia is a fear of spiders. Agoraphobia is a fear of being in public places. Last, social phobia is a fear of social situations. A patient with a past medical history of hypertension comes into the emergency room reporting the sudden onset of the worst headache of their life. They feel nauseous with blurry vision and generally appear unwell. What is the most likely diagnosis based on this history? A. Subdural hematoma. B. Epidural hematoma. C. Subarachnoid hemorrhage. D. Herpes simplex virus. The answer is C. Subarachnoid hemorrhage. The worst headache of my life or thunderclap headache is characteristic of subarachnoid hemorrhage. This is bleeding in the brain and must be treated urgently. It is usually caused by the rupture of a barrier within the blood supply to the brain. Hypertension is a major risk factor. A 50-year-old female client recently diagnosed with multiple sclerosis, presents to the clinic after having a history of several neurological symptoms and is asking the nurse about her condition. The nurse is glad to teach the client about multiple sclerosis. Which of the following statements about multiple sclerosis is correct? A. Multiple sclerosis is a disease of the dopamine-producing neurons of the substantia nigra of the midbrain, causing overall weakness. B. Multiple sclerosis is a genetically transmitted disease which affects the basal ganglia and the extrapyramidal system with a deficiency of acetylcholine. The effects are seen in both physical and cognitive dysfunction. C. Multiple sclerosis is a progressive and chronic degenerative disorder. The condition leads to demyelination of the nerve fibers of the central nervous system, causing various neurological defects. D. Multiple sclerosis is a disease where excess release of dopamine and increased serotonin levels lead to neurological dysfunction. E. Multiple sclerosis is an autoimmune disease of the neuromuscular junction characterized by variable weakness of different muscle groups. The answer is C. Multiple sclerosis is a progressive and chronic degenerative disorder. The condition leads to demyelination of the nerve fibers of the central nervous system, causing various neurological defects. Multiple sclerosis is an autoimmune process with no exact known cause. The myelin sheath is attacked and plaque formation occurs in various regions of the CNS. Without myelin, nerve conduction slows down and may eventually be completely blocked, leading to widespread loss of function. Loss of the dopamine-producing neurons describes Parkinson's disease. Excess dopamine describes dementia. Deficiency of acetylcholine describes Huntington's disease, and the autoimmune disease of the neuromuscular junction is known as myasthenia gravis. Bell's palsy is due to dysfunction of which of the following cranial nerves? A. Cranial nerve 8. B. Cranial nerve 7. C. Cranial nerve 3. D. Cranial nerve 4. The answer is B. Cranial nerve 7. Bell's palsy is due to dysfunction of cranial nerve 7, the facial nerve. The facial nerve provides motor control to the musculature of the face and sensory innervation of taste, facial sensation, and parasympathetic innervation of the submandibular and sublingual glands. Which of the following classes of medication is not used for treatment of migraine headaches? A. Antidepressants. B. Triptans. C. Beta blockers. D. All of these may be used to treat migraines. The answer is D. All of these may be used to treat migraines. Migraine headaches are commonly treated at first by over-the-counter, OTC, medications such as NSAIDs and acetaminophen. Other treatment options include triptans, antidepressants such as amitriptyline, and antihypertensives, beta blockers and calcium channel blockers.